Good afternoon, Madam Chair, members of the board. Thank you for having me. Anna Roth, Contra Costa County Health Director. Today, we're going to go over, I'm joined today with our County Health Officer, Dr. Chris Farnantano, and we're going to go over the current state in Contra Costa County and the state of California around COVID-19. We're going to summarize some of the changes since when we last joined you on June 23rd. And then Dr. Farnantano will be available to answer any questions around the health order, and the two of us will kind of field any questions that come up along the way. So if that's okay, I'll get started.
Go ahead, Anna. Perfect.
So as of July 12th, here in California, the cases continue to rise. We're over 320,000 cases in the state of California, with over 7,000 lives lost. We have currently we're seeing this rise across the state. So there's something called a monitoring list. Currently, there are 32 counties in the state of California that are on this monitoring list. And we are one of the 7 Bay Area counties that's also on that list. And so I'm going to talk a little bit more about that because that's important to sort of keep in mind. But because of this overall rise in cases across the state, the governor, through the California Health Officer, this Department of Public Health, announced important updates yesterday around the health orders. And one of the things that they have restricted across the state was they've restricted, there will be no dine-in restaurants across the state of California, no wineries or tasting rooms will be open, no movie theaters, no family entertainment centers, for example, like bowling alleys or miniature golf or batting cages or arcades. All zoos and museums have been closed, as well as card rooms. And additionally, bars, brew pubs, and breweries must close both all indoor and outdoor statewide, unless they're offering sit-down meals. So not like a bowl of nuts or a bag of chips, but an actual sit-down meal. And because we're actually on a monitoring list, there are further closures for counties who are on those lists, and that includes Contra Costa County. So here in Contra Costa County, in addition to those closures, also closed for operations based on the governor's order is fitness centers, worship services that are indoor, protests indoor, offices for non-essential sectors. So we're going to talk a little bit about telecommuting again, personal care services like nail salons, body waxing, tattoo parlors, hair salons, barbershops, and indoor malls. So those are important, I think, updates that came out yesterday from the Department of Public Health, the state level. And so those kind of, Chris will be available, Dr. Farnantano, to talk a little bit more about any nuances around that. But I'm going to kind of move straight into kind of the current state in Contra Costa County, because a great deal has changed since I talked to you 3 weeks ago. So on 3 weeks ago, on June 23rd, when I spoke with you, we had 2,586 cases. It took us 3.5 months to get to 2,586 cases. Today, 3 weeks later, we have over 100% or nearly 100% increase. We have 5,023 cases. Which is an additional 2,497 cases. And sadly, we've lost 92 lives here in Contra Costa County. There continues to be growing evidence. I know I've said this each time we've talked, but there's growing evidence and that there is just widespread community transmission with the highest case rates in our low-income communities and the more diverse communities, particularly where we know people are having to go out of the home, either for working or for other reasons. On June 23rd, when I was here 3 weeks ago, the 7-day percent positive was 3%. That's the number of tests that are testing positive. And as of Saturday, our rate went over 8%. The 7-day average was over 8%, which was the threshold goal, which Dr. Farnantano will talk about a little bit later in our presentation. Overall, 2/3 of our deaths, that's 64 of them, have been from long-term care facilities. On May 29th, we actually ordered, our health officers ordered test requirements to test all residents baseline at least once at residential care facilities or congregate living facilities. And then the personnel that move in and out of those monthly. So that's been going on since May 29th. We are closely monitoring the indicators that were set by the Bay Area health officers. So there was, if you recall, there was 5 indicators set by the Bay Area health officers, but there's also 6 indicators set by the state. So we're actually monitoring all of those indicators, because really the ones that are set by the state are the ones that put you on the monitoring list. So those are becoming more and more important as sort of the state starts to standardize the monitoring and surveillance across the state. So we'll be watching that carefully. And how we got on the monitoring list is that we have had an over 20% rise in our 3-day hospitalization rate. And so that means that the threshold for that is you can't have more than a 10% rise. And so we've had, sort of too steep of a rise in the hospitalization rate outside of the comfort level of the State Department of Public Health. And so that sort of put us on the monitoring list. This information is located on our public dashboard at cchealth.org. So as I said, we now have 5,023 cumulative cases. We have 92 deaths reported this week, 64 of which are associated from congregate care facilities. One other kind of point I want to sort of point out around how this is evolving. On June 23rd, we were addressing 9 outbreaks. Today, we're addressing 23 outbreaks. So just the scope of the spread of the transmission is sort of growing from every direction, really keeping both ourselves and our partners very busy with many, many pivots along the way. I want to acknowledge the partners. I mean, they've been fantastic. People have been working day and night on sort of this response. And so I just want to express gratitude for that with all of our partners, including the big area health systems, as well as all the way down to the small, family-run residential care facilities. Currently, we have 79 people here in the hospital. 3 weeks ago, we had 35. Currently, of those 79, 6 are not residents of our county, and 13 of those are from congregate care facilities. I know I'm giving you a lot of numbers, but somebody's going to ask. And so this will be recorded and people can come back and kind of go over these numbers. Additionally, we know that Alameda County has approximately 20 Contra Costa residents hospitalized there. So as we see increased testing, we're not only doing increased testing, but our positive testing rate has gone from 3% to 7 to 8%. So in summary, again, I just want to remind everyone, I know I say this every time I come to the board, but cases are increasing, hospitalization is increasing, deaths are increasing. We still do not have a vaccine. We still do not have a treatment. And so it's so important for people to really take seriously the basic, I think, health measures that you can do to protect yourself, which is really wash your hands, cover your face, keep your distance from other people at least 6 feet. And then if you're sick, please stay home. And in addition to that, we want to encourage people to get tested, and especially those who have any high contact with in the community or with people who are vulnerable or elderly. We really want you to get tested. And we'll talk a little bit more about the testing in just a moment, but if for those who are wanting to log on right now, you can go to cchealth.org and it'll take you right through the testing process to sign up for a test. We are also continuing to recommend to employers, and as did the governor, to consider options around reducing bringing people into work, including looking at your telecommuting practice, also making sure, again, you go back and review your sick policies, your sick time policies, because we really don't want people to come into work if they're not feeling well, and if they don't have to physically come to work, we really would like them to be accommodated in some other way. So this is all around supporting distance from each other for the time being. Most of our increase in hospitalizations, as I said, 13 of our current hospitalizations are from congregate settings, but so that means really most of those hospitalizations actually appear to be coming from community dwelling residents, and not actually, the majority are not coming from nursing homes or skilled nursing facilities. We are having regular, at least every other week, and pretty much multiple times a week, actually, over a variety of items, we meet with the area hospitals. All of the hospitals have surge plans. All of the hospitals have certified that they have access to 30-day supply of personal protective equipment, or PPE. But we're still getting requests from skilled nursing facilities, medical offices, and other congregate facilities. The most requested PPE item from our logistics team is masks. That's the number one. The second is gowns. And overall, our requests have gone down. They're about 100 requests a week now. Since we sort of opened our logistics, we received over 3,000 requests, and with so far 98% of those we've been able to fulfill. And just kind of as a summary, that's over 1 million masks, hundreds of thousands of gloves, gowns, testing supplies, and disinfectant supplies that we've moved out into the community and to our area partners. We have gone back out and re-reviewed our surge capacity. We've been looking at that in the past couple of weeks again. As you recall, we have secured and have stood up the Craneway Pavilion, which has a capacity of 250 beds and could be open within a 4-hour lead time. We also have the Antioch Fairgrounds, which could serve for a site for 43 individuals. We also have secured 566 hotel rooms. And there's a variety of hotel rooms within there. Some are for asymptomatic people who are not suspected of having COVID, but in need of isolation, or in need of being moved out of high-risk situations, such as homeless individuals. And then there are some that are specifically for persons under investigation. Right now, our Project Room Key, which is our hotels that are specifically those homeless individuals who are not under investigation, is at 97% capacity, or 446 people are currently in hotels. Testing, we've done almost 100,000 tests cumulatively, and currently we're at 171 tests for every 100,000 residents. That's above the state's threshold of 150 tests per 100,000 residents. But as you recall, the Bay Area health officers sort of set a very stringent indicators and guidelines, and they want to see 200 per 100,000. So we're approaching that. We've been steadily increasing. Testing continues to be a challenge, but we're steadily increasing overall. We have actually increased our testing appointments across the county. So we included, since the last I talked to you, we actually did include open up a testing site in Richmond at Kennedy High School. We also have opened up our community health centers in West County. The West County Health Center, the Pittsburgh Health Center, and the Martinez Health Center have opened to weekend testing now. So that's in addition to Bates. We're also offering the less invasive test now. So I'm sorry, Supervisor Anderson, I know you got the invasive test, but now we have the less invasive test. So it doesn't have to go as far up the nose. It's just sort of at the front end of your nose. And actually, you can actually do that yourself. You can self-swab. So testing's come a long way since it was first introduced, and so we're happy to offer that at our county sites. We also have state sites operating in Contra Costa County, and so I'm not sure if they are doing the less invasive tests yet, but I think those are slowly being introduced at all of the sites, including the state sites. We have them at all of the county sites. We're currently working with other healthcare providers in the region, such as Sutter and Kaiser, as well as John Muir, to support increased testing. They face very similar issues as us. We're all, there's a variety of issues around supplies. Sometimes it's swabs, sometimes it's the reagents, sometimes it's the testing kits themselves. And, so we're constantly working that sort of equation, backfilling where there's shortages. And we all continue to have our staff, continue to be stretched. The machines can only run so many tests at once. So we're, sort of working around the clock with testing. Currently, there's a 22-minute wait on our call line. So if you called right now at the 1-844-421-0804, you would get a 22-minute wait on the call. Or you can press the option to leave your phone number and hang up and save your place in line, and we will call you back automatically. You can also, if you don't want to call and do that, you could go again to cchealth.org. And you can fill out, it takes about 5 minutes. Apparently, and if you have Contra Costa Health plan, it takes about 2 minutes per Dr. Farnantano, but you can go on and you can make your tests online. You can book a test online. And our next available appointment for us is about 7 days out right now. And for the state sites, it's about 2 weeks out. So, I think we have a lot of work to do to keep up with the demand, which we're very happy to have the demand for testing. And this has been recognized as a state challenge. And I think if you, and I know you guys didn't have the opportunity because you've been in session all day, but Secretary Galley, the health secretary for the state, just talked at noon today about the need to improve testing and streamline testing. And so this is very much on everyone's radar. Our government relations director, Dr. Walker, is working with our state and federal delegations. And so there's a lot of advocacy going on. Again, I think there's been a great deal of improvement. It's not where we want it to be yet, but it's really come a long way. In terms of tracing, at the end of May, we became a pilot site for the new state contact tracing software called CalConnect. We're working closely with the state to make almost daily changes to this software to improve it. And this is very typical. When we rolled out our EHR, it was the same thing. There's a lot of local tweaks that have to happen to really refine that software. And integrate that, and so that it can receive the lab results electronically. And things are becoming more and more automated every day. So we're feeling much more positive about this because we brought a lot of staff online onto this software. We've been bringing staff on, and I'll talk a little bit more about that in a second. But lots of staff on to support our contact tracing and disease investigation. And we're really grateful to the board for your support around increasing those positions. However, we still have a couple of things that we need in place. Mainly, we need the lab results to come back in a timely manner, and we're working on that in a variety of ways that I just talked about. We continue to need even more staff, and we have a plan for that. We have a plan on bringing on staff, but we still have some barriers we need to overcome. And then the final thing that we need is partnership with the community. We really want people to know that the information that they give when our investigators call or our tracers call, the information is confidential, and the information is not shared. It's not de-identified. So we keep it confidential, and I think that we want people to participate with us in the tracing process. And I know it feels intrusive or a little bit big brothery, but these are public health. These are public health individuals that do this. They've been doing this for a living forever. They live and breathe by confidentiality, and we really need those. We need that participation so we can actually help each other protect each other. So I think between the demand and the getting the supplies, and as well as I think the resulting of the labs. That's the other sort of thing I want to stress is that some of the majority of the labs that we draw, the tests that we do, we actually send them out because our public health lab can only do a few hundred a day. And so the majority go out, and that time, the time of getting those results back, has been getting longer and longer and longer. This is not a Contra Costa specific problem. This is a big problem across the state, and I think across the country. So our average time for our own tests that we perform is about 4 days, and it can be as short as 1.5 to 2 days, but it's about, the average is 4 days. But for 10% of our tests, that they're actually taking longer than 8 days. And so, we're tracking that very closely. We've been working with the commercial labs really closely on figuring out what are the issues. And I think that the main issue is just, frankly, they're just being totally overwhelmed because everyone has been bringing their testing, in expanding their testing greatly across the state and across the country. And it's really coming down to there's X amount of labs that run these tests and that have that contract to run these tests. So we are working on and investigating other labs if that's an option. We haven't landed on anything yet, but we're certainly looking at that and have been trying to identify other labs that can do that. Our staff have been working on all our staff across the county have been working on the COVID response. So it isn't just health services. We've been really fortunate to have partnership with the Office of Emergency Services, Public Works, the library. We have staff, many staff from across the county working in our tracing and investigation line. And I want to acknowledge those department heads who have been, just didn't even question and have really been supportive of this all-out effort. We have requested 50 more. We actually got 30 staff from the state, tracing staff from the state last week. We've requested overall 50, so 30 are already here, 20 are coming at the beginning of August. However, we still need more staff. And on May 12th, I just want to thank you and give you an update that on May 12th, you approved 25 positions called disease investigation technicians. Of these, we've hired 24 to date. Two of these positions actually went to former library staff who were going to be laid off. It was our understanding. On June 4th, you approved 104 temporary emergency worker classification positions, and at the end of this week, we will have filled 86 of those of the 104, and we're working to fill the rest of those in the next 2 weeks. And of the new 110 county employees now on board, 69 of them are assigned to case and contact tracing. And not all of them are tracers. Some are doing case interviews. Some are working with the software development. Some are addressing outbreaks. And so it's, again, as we talked about, as the pandemic sort of expands in scope, it's sort of pushing us again. It's constantly challenging us to rethink the boundaries of what we were planning, and then we have to replan. So I just wanted to let you know where those staff have gone. Some of the employees are also in the Get Tested call center, as well as the main COVID call center, which everyone is very familiar with that number. That's where when you have a question that you can't get answered with the frequently asked questions, you can call our 1-800 number, and you can ask the COVID line. One other, I think, important message. I think that one of the things I wanted to just sort of say is that, again, I talked about the participation of the community, and so it's we're really trying to figure out what would work best, and we have a particular branch within our COVID team called the outreach branch, and we're trying to understand how we can best connect with the community. So far, that we were able to interview 29% of the cases, and of the cases that we reached, 43% of those provided us with contacts, and of those contacts, 68% of the contacts were interviewed. So I know there's a lot of numbers again, but just to say, if we can't get to like the 90% on the front end, which is very challenging when you have a 8 to 10 day lag for your labs, that starts to then affect your tracing on the back end. And so one of the, in addition to the message of stay home if you're sick, is if we call, please answer the phone, and we would really appreciate being able to talk with you and help you protect the people around you and protect yourself. One final thing I wanted to go over is just we've talked about it before. I just wanted to give a quick, brief update from the foundation, the Contra Costa Regional Health Foundation, because that's come up before, and there are several of us who work closely with them. And so the Contra Costa Regional Health Foundation established a COVID-19 Rapid Response Fund in March of 2020. And the foundation was selected as a lead partner organization in the COVID-19 Regional Response Fund, which is supported by the Silicon Valley Community Foundation. The foundation also received generous donations from Chan Zuckerberg Initiative, as well as many donations from individuals. So I just want to acknowledge that generosity that's moved into our county, and specifically related to COVID-19. Since the fund's inception, the foundation has granted over $1.2 million to local organizations. 34 organizations have received this funding, and I would be happy to send a report to you, or we can talk about it if you have specific questions, but there's so many, I don't think we have time to go over all of them. But essentially, there are 34 local CBOs that have received money, grants that wrote for grants around financial assistance, mostly focused on food, shelter, and other essential needs. And so I just wanted to make sure that I close that loop with you, because I know that came up earlier. So I think, again, for me, in summary, is I just wanted to say that the COVID crisis, the pandemic, continues to expand. It's very nuanced, it's very complex, it's far-reaching, and I want to thank the county for your support. I want to thank our partners. We continue to be in regular contact with both the city manager group as well as the police chiefs. We're joining them or some other group, the school district as well. We're working really closely with other sectors and other agencies, and we have maintained sort of 100% momentum since January 27th, when this really started. And I want to appreciate all of our staff for having so much stamina and determination, and also creative thinking, because we're way far outside of the box right now. And I just really appreciate also the support of the board, who have been there with us from the beginning, and really appreciate you for that. That's the formal presentation. Dr. Farnatano actually doesn't have anything formal to present. We're happy to answer questions, because we figured that the order will come up during that time. So unless there's anything more specific, happy to move to questions at this point.
Okay, and so any questions, board members? I know we bring up a lot of questions to Dr. Farnatano on our morning briefings. One that has recently come up, Chris, is the state initially ordered people who are over 65 years old and who had underlying health conditions to shelter in place. And there's some discussion among leaders in the area that still applies, that's mandatory. And I know in our health order, we encourage people who are over 65 or vulnerable to remain in their homes and not go out. But there's some concern that people are actually violating the order if they're over age 65 or have a compromised health condition if they leave their home. And I'm just wondering if any of the health officers have weighed in on that in conjunction with the state's order that's out there.
Yeah, my understanding is that the state's order advises senior citizens to take extra precautions and to be extra careful, but it doesn't mandate behavior that's different from younger adults. So their ability to work and go out is not statutorily different. There's just extra encouragement because they are at high risk to be extra careful in limiting their interactions out of the home.
Okay, and I will convey that to that local leader who was concerned about that. So thank you. Diane, go ahead.
Yeah, as the governor kind of starts to exercise more control over the situation, Dr. Farnatano or Anna, can you answer? I know there's a lot of people that I've been kind of seeing on social media and in discussions that want to travel. And I know that flying is not something that people are recommending, but I see families wanting to do certain things. What is the recommendation at this time?
There are, some limits, based on where you're traveling to. And certainly if you're traveling out of state, certain states have requirements that individuals quarantine for 2 weeks upon arriving at the state. Traveling within California, it really depends on where you're traveling to and what the county that you're in and what their local restrictions are. Generally, travel for essential services or permitted activities that are allowed in that county is allowed. However, in many counties, including our county, hotels for non-essential travel aren't supposed to be operating. And so if you're traveling into a county and you're planning on staying in a hotel just for leisure travel, that you'd have to check with that county. That may not be permitted.
So camping, is that allowed at this time?
Yeah, both and throughout the state, camping is under the outdoor recreation activities guidance under the state, and that is allowed in both monitoring and non-monitoring counties. So that travel for camping or outdoor recreation would be permitted.
Or renting a cabin?
That is a little unclear. Most of that would fall under the sort of lodging, hotels and lodging. And if it's for, recreation in certain counties, that is not allowed. So you'd have to check county by county.
So in other words, people really need to think about what kind of plans they're making if they're going to try to travel this summer. Definitely.
You'd have to really do your research, figure out where you're going and, what is allowed in that county.
Thank you.
Okay, the other question that has come up too, how long will we remain on the list? If we stop increasing at 10%, between that 10 and 20% in hospitalizations, after 3 days, will we be taken off the list until we see an incremental jump? And then there was some discussion that there was a sort of this magic 3 weeks that we're required to, once we're on the list, to follow these stricter guidelines. So can you clarify that a little bit for us?
Yeah, so there's several different categories that place a county on the list. Director Roth had mentioned the hospitalization rate going up. Also, the absolute case rate is above a certain number. Right. Also put you on the list, and we're exceeding that as well. Some of the other categories, like our ICU capacity, we're not at that level yet. But if our indicators improve and we are below those indicators for 3 days, we move off the list. Previously, the state had said if you are off the list for 3 weeks, you may have permission to open new categories of businesses. However, with this new order on Monday, the state has said that these business sectors that are required to close must remain closed until further notice. And counties on the monitoring list are not allowed to open any additional sectors, even if they're sectors that they weren't specified to be closed. So So, and they don't have a fixed date on when that would change. So it's really until further notice at this point, even if, so they remove that requirement about 3 weeks being off the list, you may be able to move forward.
Okay, great, thank you. Okay, other questions by board members, other comments? Karen, please go ahead.
I thought I understood it, but now I'm confused, and it's not your fault. Okay, you told us yesterday, I thought, that because we exceeded the positivity rate over the weekend, the state put us on the list. But then I heard Anna say that we were put on the list because of the hospitalization. So are we on the 3-week list because of the positivity rate, and we have to keep under that 8% for 3 weeks, and then we can consider what we want to do next relative to reopening or opening further? Am I correct in that assumption?
Currently, we are on the list for 2 indicators. Our 3-day average hospitalization rate is gone up more than 10%. It's actually gone up 20%. And
Okay.
also our case rate per 100,000 individuals has gone over 100, and it's currently at 120. So those are the 2 reasons that place us on the monitoring list. With the state's order on Monday, those business sectors that are required to close, and for us, it really, most of those things were closed already. The only things that were, new required to close were, hair care, barbers and hair salons, indoor malls, and non-essential indoor offices. Those and the other closed sectors must remain closed until further notice. There's no longer a rule about being off the list for 3 weeks and then being able to move forward.
And that's okay, because we talked yesterday morning, and then the governor's order came out.
Yeah, and that was clarified yesterday afternoon.
Okay, so we can't do anything until further order of the state on
Correct.
anything. Okay.
Correct.
And so I'm sorry, I guess I thought I heard you say with the 3-day issue relative to hospital beds and cases, that keeps us on a list indefinitely too, or do we come off whatever list that is after 3 days of those numbers going down? Or it really doesn't matter?
We do come off the monitoring list, but that coming off the monitoring list doesn't change our ability to open new business sectors.
Okay, no matter what the indicator is, wherever we are, as of yesterday afternoon, until further notice, we are at where we're at.
As far as business sectors, correct.
All right, thank you very much.
Okay, anything else from anyone else? Okay, Anna and Chris, thank you both for being here. We appreciate all that our health department is doing. It's just here when we sort of thought things were going to just keep going smoothly, they're not. And so we appreciate everything that our health team is doing to deal with this continued crisis that we're in right now. So thank you very much.